Hello, class and professor. Today I'll be discussing our Unit 4 video discussion on arterial line placement. So question number 1 was to obtain informed consent from the patient for the arterial line placement. So you want to start off by explaining the nature of the procedure and the reason for the arterial line placement to the patient, and letting them know who is going to be inserting it. They were also explained the purpose of the arterial line, which is to provide continuous blood pressure monitoring and give access for frequent arterial blood sampling. Contraindications were also explained, which include peripheral or distal arteriovascular insufficiency, peripheral arteriovascular diseases, anatomical variants in which there may be a lack of collateral circulation, infection at the site or insertion, or coagulation disorders. Complications were also explained, including catheter-related infection and inflammation, which are the most common, also embolic or thrombotic events, and amputation for ischemic injury. I also explained alternative treatment besides the arterial line placement, which I did find in my reading of something called non-invasive continuous arterial pressure system, but of course it's not as accurate as an arterial line. The patient acknowledged and understood the procedure and signed the informed consent, agreeing to have the procedure done, and I signed it as the witness. For question number 2, it was to discuss a step-by-step process on placing the arterial line to the right radial artery. This is very long to explain in the short time I have, but basically it states that this procedure is done in a sterile fashion. An Allen test is performed first to make sure that the radial artery is indeed usable for the arterial line placement. Then the site is cleaned with ChloraPrep and draped in a sterile fashion. The catheter is placed in the artery with bevel up. It's placed at a 30 to 45 degree angle. Once you have a flashback of blood, you gently slide in the catheter with a twisting motion, secure it with suture, and then put a clear sterile dressing on top and write the date on it. Then you hook it up to the monitoring, make sure you have a clear waveform, and make sure it was successfully put in. For number 3, we're going to write up a procedure note for the placement of the arterial line. So there you're going to put the indication for the line, who placed it, that you got informed consent for the procedure, and then a brief summary of exactly what was done in the procedure, including estimated blood loss. Question number 4 was, while in the OR, that same patient had an ABG done post the arterial placement. What was the interpretation and what is the possible etiology? So the ABG results came back as compensated metabolic acidosis. This is because the patient is in liver failure, hence the liver transplant. According to Gao et al., in addition to the kidney and the lungs, the liver is a crucial acid-base regulation organ, playing an important role in lactate metabolism, ketogenesis, albumin synthesis, and urea production. Therefore, severe liver damage may lead to metabolic disorders, causing the metabolic acidosis. For question number 5, how would we communicate these findings in transfer care from the OR to the PACU? So we would explain that an ABG was drawn post the arterial line placement and that the patient was in metabolic acidosis. We would continue to monitor ABGs post-op to see the improvement in the ABGs. I did read that metabolic acidosis is common during immediate postoperative period. There is an inverse proportional relationship between the quantity of saline solution used during the surgery and the inorganic ion difference during the immediate postoperative period. Hyperchloremia is the primary contributor to the metabolic acidosis in liver transplant recipients. Last, for question number 6, my 2 open-ended questions. For number 1, what are the most common complications of liver transplant surgery? and what are the risks associated with arterial line placement. I hope you enjoyed my video discussion, and I can't wait to see yours. Thank you.